Health facilities have also been badly affected by the deadly floods in KZN. Nursing organisation Denosa is calling on government to prioritise areas affected and ensure safe passage to reaching health centres. Let's now chat to Denosa's acting KZN secretary, Mbali Sabela. Thank you very much, Ms. Sabela, for your time here on All Angles. I imagine, listening to my colleague Siphamandla Goke paint the picture of bridges and roads that have collapsed, that this has made it difficult for people to reach healthcare facilities.
Thank you very much, and good day to you. Good morning to your viewers. It's very bad if you walk around and see how roads are damaged and the way that the community are disconnected to the health facilities, and the way our health facilities are damaged is very, very, very bad out there.
Tell me more about the damage to health facilities. We have been trying on this show to get the Provincial Health Department to speak to us about damage to health facilities. The last time in 2019, it was estimated that 3 million rand would be needed to fix health facilities after those floods. So what are you seeing? And according to your members, how are hospitals affected in terms of damage to infrastructure?
With some institutions, it's the matter of drainage systems that are not properly working, and then you find that there are floods flowing over the building. And at the moment, the most damaged facility is in under A clinic. It's still closed because and I think it sees as much as the water were flowing inside the institution, but the water now has subsided. So with the damage financially, I can't really say how much, but it shows that we need to work on our drainage system, especially within our facilities, so that to avoid such things. And then other damages are uncontrollable, and you can't say what exactly the department must do to avoid them, especially if the road is flown off and the bridges are flown off. So you can't say exactly the government what must they exactly do to do that. But we are calling for the government to prioritize the roads that are connecting the communities and the health facilities, because we are really suffering with the shortage of staff at the moment.
Talking about the shortage of staff, I mean, sometime during the course of this week, especially earlier in the week, people living in Durban and some of its surrounds were asked to rather stay at home. So a lot of people, including some of my colleagues, actually couldn't make it to work because of the damage to infrastructure in terms of roads. So I'm just wondering, in terms of the change in shifts, were nurses and doctors able to get to hospitals or leave hospitals?
Especially on Tuesday, those who were on duty by that time, they couldn't leave, and then they relied on the staff that are staying at nurses' home or within the institution. Then they use those, and they try to arrange food for those who were working day and night. And then some, they use the short roads to get off. And then those who are supposed to come on duty, is still a challenge to get to come to work, especially if you see the township like Umlazi, and then the joining routes that comes from Umlazi to town. It's very difficult to use. They're only using one road, which is Pingo roads. So it's very difficult for everybody to use that one road. And those who are staying at the rural areas, especially at Emapeleni, if you're looking at Uku, if the bridge is disconnected, and then it's very difficult to get to work for the staff who are staying on that side of the province. And with the shortage of staff, it's a skeleton staff at the moment, because not everybody can be able to use those shortcuts to get to work, and not everybody can be able to have a transport that can, because even my staff here at the office, they have to walk a certain distance to join another taxi to get to work. So it's very difficult for the staff to come to work. At this point, as we are facing the challenges of the shortage of staff, even if there is no disaster. So imagine now how we're working, because it's very difficult. So we are facing a big challenge of the shortage of staff at the moment.
And I imagine with the shortage of staff, something that we've had a problem with in South Africa for some years now, with the shortage of staff and what's happening currently in KZN, people probably with injuries needing some assistance, does that not then add to the pressure at healthcare facilities in the province?
There is a big pressure because even ambulances are facing the challenge to get to the community. If they got the call to come to pick up a patient, it's very difficult to get there. And then even if they get there, they can't transfer you to the nearest. They need to take you to the institution that they have a rules to get there. So it's very, very difficult to manage with the workload that we are facing right now. Even the patients that they have the floods, they've attacked by floods at their homes. They don't have medication at the moment. They need to get to the health facilities to get the medication. That's why we are calling to the government to prioritize, to make sure that these roads are back on working. Maybe they can work over the weekend to try to make sure that they connect the people. Because another thing that is faced by our members out there is the matter of no electricity, no water. Then how can you prepare yourself to go to work? No network to call even the institution to report that you're not coming on duty because of this 1, 2, and 3 and 4. So it's very difficult. It's frustrating for the operational managers to get hold to their members, and it's frustrating for our members to even to report to their operational managers that they're not coming on duty. The situation is very bad.
Oh, such a terrible situation in KZN. You cannot imagine the type of frustration. Thank you very much for speaking to us on all angles. Mbali Sabela from Denosa there. What she paints is actually quite scary.